Hello and welcome back to Karisu. Today we're going to be talking about appendix or appendicitis. We've all known a friend or a family member who's had appendicitis before. Today I'm going to be explaining to you in detail what is appendix, how it happens, and most importantly, what are the signs of appendicitis. So without wasting any more time, let's get straight into it. So what is appendix? The scientific name for appendix is vermiform appendix. And vermiform literally means looks like a worm. That's because the appendix literally does look like a worm attached to your large intestine. It's around 8 to 10 centimeters long and it's attached to the beginning part of your large intestine. So we have our small intestine here. Sorry for the ugly drawing. We have our small intestine all coiled up and then it joins into our large intestine. And our large intestine has four main parts. The one which goes up, goes to the left, goes down and swirls down into the anus. So the beginning part of the large intestine has a worm-like structure which sticks out at the bottom. This is what your appendix is. This is where it's located and that's what it is. And appendicitis is the inflammation of the inner lining of the vermiform appendix. That means inside the appendix it's swollen up and that's causing all the symptoms which you see in appendicitis. Despite medicine progressing every day, we are learning new things every day, appendicitis is still a clinical emergency. That means it has to be treated immediately and the only definitive treatment for appendicitis is cutting it off. So how does appendicitis happen? Let's imagine this to be the appendix. It's the only prop I have, excuse me, yeah? The appendix has an opening which is joined to the large intestine like I showed earlier. And appendicitis happens regardless of what the cause is. It always happens because of obstruction of the opening. That means the opening of the appendix is blocked. So what happens when it's blocked? Inside the appendix, it's still a human tissue. It's still a part of our body. So it has mucosas and cells which secrete fluids and mucus inside. So when it becomes blocked, these cells are still going to keep releasing mucus and fluid inside. So it's going to become filled with all this fluid and there's no way out. When this happens, the existing bacteria inside, our body always has bacteria inside regardless of how clean we think we are. There are good bacteria and bad bacteria. The amount of bacteria present plus the state of our immune system determines whether we get sick or not. So the bacteria is already present there and now there's nothing stopping it from being flushed out. And this happens, it's going to start multiplying inside. They're going to start mating and they're going to be producing more and more bacteria. When the amount of bacteria increase beyond a certain threshold, when there's too much bacteria inside, the body is going to start directing white blood cells there because now the body recognizes that it needs to fight these bacteria. And when white blood cell comes here, this place is going to start having pus. Remember I said the opening was blocked already. Now there is fluid, mucosa and pus inside. So the pressure inside is going to be even more larger. And like I said, appendix is part of our body. So there's going to be blood vessels all along it. So what happens when the pressure inside starts pushing too much? It's going to start obstructing these blood vessels. So the blood supply to the appendix is now compromised. When the blood supply is compromised, ischemia happens. Ischemia basically means the wall cells are dying because they don't get oxygen anymore. And when the wall cells die, the wall integrity drops as well. Within a few hours, it can worsen into perforation and gangrene. Perforation means the bacteria now manage to poke a hole through the wall and now they are coming out of the appendix into the abdominal cavity. That means they're going to start spreading everywhere. And gangrene basically means the appendix is dead. Now you have something dead and rotting inside your body. When perforation happens and the bacteria start spreading all over the body, you're going to have something called peritonitis. A peritoneum is this thin sheet of tissue which lines all your internal organs. That means it's lining your stomach, your liver and everything. So this is going to get infected and it's going to start swelling and you're going to have more pockets of pus all around the appendix and around the area of the appendix. It's called periappendicular abscess. There are a number of things which could block the opening of the appendix. It could be infection or it could be fecalates. Fecalates are basically crystallized feces. It could also be parasites which are blocking the entrance. Foreign body, if you accidentally swallowed your tongue stud or something, that could block the opening, and also tumors. In rare cases in tuberculosis, the tuberculosis itself could obstruct the opening of the appendix. So what are the signs of appendicitis? The classical sign of appendicitis is notoriously inconsistent. Means the classical sign itself only happens in like 50% of cases. So what are these classical signs? The main thing is anorexia. Anorexia means you lose your appetite to eat. And then there's abdominal pain, nausea, vomiting, and also either diarrhea or constipation. But like I said, this whole thing only happens in like 50% of the case. So let's talk about the pain. The pain in appendicitis is something like a defining symptom of appendicitis. Why? Because the pain usually starts in the middle of the stomach, around your umbilicus, around your pusat, and over a few hours, the pain will start moving towards your right hip, or it's called the right lower quadrant in medicine. This moving pain is characteristic for appendicitis. Patients who have appendicitis will usually lie down and bend their knee towards their chest so that they reduce the movement in the right lower quadrant in the right hip, which usually aggravates pain. There are some interesting signs in appendicitis. One of it is called rebound tenderness. That means, let's say this is your right hip, your right lower quadrant. When I'm pressing it in, the patient won't feel much pain. But when I let go, all of a sudden the pain will shoot up like crazy painful pain. That's called rebound tenderness. Besides that, if I'm percussing, if you have gone to the clinic at least once in your life for stomach ache or something, the doctor usually put the hand on your stomach and they keep tapping on it. That's called percussion. And every time you percuss an appendix patient, they're gonna feel pain. And the stomach is gonna feel like it's covered with a board or something. It's guarded, like it's really hard. In very rare cases, the pain will be on the left side, on the left hip or left lower quadrant. There are two main incidents where this will happen. One is called Cytos Inversus. And Cytos Inversus is literally, if you're looking at yourself in the mirror, how will your organs look? All will be flipped over to the other side. That's what happens in this person's body. That means this patient has all his organ in a mirror image to other people. So his appendix is going to be on the left. His heart is going to be on the right. So in this case, the pain will be on the left side. Or if the appendix is too long, so long that the tail goes all the way to the left side of the hip, left side of the body, then there'll be pain on the left lower quadrant or left hip. For small kids, infants or children, boys especially, if they have appendix, their scrotum or their ball sac is gonna be swollen. That's another sign of appendicitis. If you're pregnant, the first half of the pregnancy, the sign is gonna be rather classical. That means the right lower quadrant, the right lower hip is gonna feel painful. But if you're in the second half of the pregnancy, now all the organs inside the body will be pushed upwards, so the pain is gonna be higher. It's gonna be in your right upper quadrant. Now, there are certain signs we use in medicine to determine whether this is actually appendicitis or not. Just a disclaimer, I'm not doing this video for medical students or housemen. If you are a medical student or a houseman, please do more reading. Don't just follow 100% of what I'm saying, because I'm trying to explain it more towards the general public. So the first sign is something called a Rothschild sign. That means if the patient is lying down and I press on his left side, left lower quadrant, if I press on his left hip, he's gonna feel pain on the right side of his hip. That sign shows it's positive for appendicitis. The second sign is called Obturator Sign. That means the same thing if the patient is lying down, but this time I flex the hip, I bend the hip towards his chest, and if I rotate the hip joint in and out, he's gonna feel pain. And that's another sign which is positive for appendicitis. The third sign is a Sower Sign. Means if you have experienced appendicitis before, the doctor will usually ask you to either push against his hand and straighten your leg, or push against his hands and bend your knee. This is because in appendicitis patient, whenever they go against a force and try to either straighten their knee or bend their knee, they're gonna start feeling pain. The Sower Sign is another sign showing that this person has appendicitis. And finally, we have Tanfi Sign, which basically means whenever the patient coughs, the pain is gonna be unbearable. They're gonna start feeling pain with every cough. That's everything you need to know about what appendicitis is, how it happens, and what are the signs for appendicitis. If you found this video valuable, if you learned anything from this video, the only thing I ask is share this video with your friends or family members, spread the knowledge. If you haven't subscribed to our channel yet, go ahead and smash the subscribe button right there. And please make sure to click the bell icon, because YouTube's algorithm is changing all the time and we want to make sure that our videos come and reach you. Until the next informative video, in anything you do, do your best and be the best version of yourself. Bye-bye.